What is a heart attack?
The heart gets blood through the coronary arteries. So these are small, teeny tiny vessels, smaller than this pancreas. The coronary arteries are really small. And these arteries get the blood to the muscle of the heart. When these arteries get blocked, you have a heart attack. And the heart attack basically is a muscle damage to the heart muscle. So if you have a muscle damage, because the blood is not flowing well, because the oxygen is not going well, the part of this heart, of this muscle, dies. That's why it's extremely important to get on those really quick.
What causes an arterial blockage?
So they're extremely important for a healthy heart to have the coronary arteries to be open and patent. What can block it? A thrombus, a clot, plaque that builds up. It's like you clog your pipe. What clogs the pipe? Back again, smoking, smoking, smoking. Cholesterol, of course, other risk factors, genetics we talked about, but smoking, smoking, smoking.
What are the signs of a heart attack?
So the classic is that pain in the middle of the chest called angina pectoris, and usually it would radiate to the left arm. Usually it would go down the left arm, numbness. So sometimes patients think it's just a nerve or they're not sure. So that's the classic. Now, along with this, shortness of breath. They're very hard to catch their breath. Nausea. They get sick in the stomach. They get sweaty. So these are the classic signs of a heart attack.
What is a silent heart attack?
So silent heart attack is actually, I call it the tricky heart attack because it's more common in women and in diabetics. So what is a silent heart attack? It's a heart attack that does not present with the classic signs and symptoms that I was just describing earlier. The patient would not have that typical heaviness in the middle of the chest. Actually, they can present with indigestion. And that's the most common simulator, or the silent heart attack simulator, that worries me a lot. Sometimes very vague symptoms, like just feeling a little sick, having flu-like symptoms, and you're not sure what that is, feeling tired. And again, extremes of age, women, diabetics, where they have some nerve endings problems, so they don't have the typical pain that a usual person would have.
Who is at risk?
So risk factors, that's very important because that's something maybe we can control. Some of it is out of our hands, like genetics. We can talk about this a little bit. Basically, if you are from a family of heart disease where it's common, especially if it's at a younger age, if a patient comes and tells me, my dad died at the age of 30 or 35 from a heart attack, that's definitely a risk factor. But there is nothing we can do about this. High blood pressure, that's part of the risk factors, genetics. Also partly controlled by diet, but partly just you're born with this. You have to work on it and work with your doctor. Now, diabetes obviously is another very important risk factor. Having said all that, the most important is smoking, smoking, smoking. And this is in our hands. We can control smoking. I can quit smoking and it's gonna help a lot. If you combine smoking with family history of heart disease or genetics, it's a bad combo.
The steps to preventing a heart attack are simple. Quit smoking. Know your numbers, your body mass index and metabolic index. Exercise. Eat a healthy, low-fat diet. Drink alcohol in moderation. Avoid stress, whenever possible. And laugh a lot. The simple act of laughing will cause the lining of the coronary arteries to expand. For more information on heart health, go to the website of the American Heart Association.